In this lecture, we are going to discuss impetigo, and at the end of this lecture, we will also see the different scenario related to the impetigo. So let's get started. First of all, impetigo is a bacterial skin infection, and it is common in the infants and the young children. And you will see the different stages of the impetigo. First is the red sores. Next, you can see the formations of the blisters. And after that, you will see the formations of the golden yellow crust. When the blisters burst, then ultimately you will see the formations of the golden yellow burst. So it's a general pathway. Next is the causes. So two bacteria are the main cause of the impetigo: Staphylococcus aureus and the Streptococcus pyogenes. These are the bacteria that causes the impetigo. Next, if we look at the epidemiology, it is common in the children aged between the 2 year to 5 year, but it can also be seen in the adult as well, but it's a common one in the adult. Next, it is common in the warm and the humid climates, and it is caused when you see the poor hygiene, and you can also see the after the skin trauma, when the bacteria invade inside the skin, then ultimately it causes the impetigo. Next, we will see the what test we can do to diagnose the impetigo caused by these two types of the bacteria. We can go towards the cultures. We can also go towards the gram staining that differentiate between the strep and the staph. And you can also go towards the PCR that we can easily detect the DNA of the bacteria. And most important thing, it's a contagious disease. It can spread from one person to another person. Specifically, it's common in the crowded area and in the schools when the children play together. Next, if we look at the types of the impetigo, first is the non-bullous impetigo, second is the bullous impetigo, and third is the ecthyma. First is the non-bullous impetigo. We will see the different stages of the non-bullous impetigo. First of all, you will see the formations of the red papules. These are just the small raised area on the skin. And after that, you will see the formations of the vesicles. In the vesicles, you will see the presence of the serous fluid. And after that, you will see next stage is the pustules. In that case, you will see the formations of the pus in the uh, pustules. And after that, you will see when the pustules burst, you will see the formations of the golden yellow crust. So these are the different stages you will see in the non-bullous impetigo, and it is common on the face and the extremities like the uh, arms and on the feet. Next, you will see the bullous impetigo. In that case, you will see the fluid-filled blisters, bully, also known as bully. So after that, when these fluid-filled blisters or bully burst, and after that, you will see the formations of the brown crust. So that is the important thing, and it is common on the trunk, neck, and the axilla, means under armpit. Ecthyma, this is the third one, and in that case you will see the formations of the vesicles. In the vesicles you will see the presence of the serous fluid. When the vesicles burst or rupture, then punched out ulcers form, and after that, when after the ulcer stage, you will see the presence of the thick crust formation at that side. So here are the different stages of the different types of the impetigo. And next we will see the treatment. Topical treatment, you can see the mupirocin, you can also see the fusidic acid, and you can also see the retapamulin. So these are the different topical uh, medications related to the impetigo. And oral, you will see the dicloxacillin, you can also see cephalexin, clindamycin, trimethoprim, sulfamethoxazole. So these are the different antibiotics used in the treatment of the impetigo because it's a bacterial infection. Next, we will see the different scenario. Scenario 1, a 5-year-old girl. As the age is an also important factor, it is common in the children, so it also indicates it can be impetigo. Next, presents with itchy sores around her nostrils and chin. So it means that non-bullous impetigo commonly seen on the face and the extremities. Now this girl having sores and itchy sores on her nostrils and chin, and the sores started as red spots, then blistered and burst. After bursting, formation of the golden yellow crust. That is another other important features, golden yellow crust formation. She recently recovered from a cold and had frequently nose wiping. So it indicates like start with the red spots, then blisters, and after bursting, you will see the golden yellow crust. So you will diagnose on the basis of the stages of the impetigo. So it's a non-bullous impetigo because there is no bully formation in that case. Okay, next scenario is a 2-year-old infant is brought in with large fluid-filled blisters, also known as bully, on the trunk. The blisters are painless. There is no pain in the blisters, have clear yellow fluid and ruptured easily because it's a large size, leaving a thick brown crust. The child is otherwise well. So it's obviously seen large fluid filled blisters or bully. So it's got towards the bullous impetigo. So here are the different scenarios related to the two types of the impetigo, non-bullous impetigo and the bullous impetigo. So this is all about the impetigo, that is the contagious bacterial skin infection. If you still have any question, you may ask in the comment section. Thank you so much.